right. Thank y'all for joining me today. I want to talk to you about hypothesis. If you've never heard of it, it's a research journal for health information professionals, and it is owned by the research section of the Medical Library Association. So just to give you a little bit about the journal, um, it's an international peer-reviewed open access journal that provides a venue for original research and research-related content. So this includes research studies, but it also has a variety of different kinds of columns and articles. For instance, it has one called Failures. It has one called Voices of Experience, and it is great for first-time authors and newer researchers because the editorial board of Hypothesis is all about working with you to help you with your research, right? It's hosted and supported by the University of Indianapolis University and hosted in their library. It's published online in September and March of each year. Submissions are accepted and reviewed year-round, and it is already indexed in CINAHL, LISA, which is the Library and Information Science Source, and LISTA, Library Information Science and Technology Abstracts. And a current project we have going on now is getting it into PubMed Central, getting it indexed into there. And so we're in the process of figuring out all the XML requirements and such for that. Works in Hypothesis are licensed under, and this is the official name, CC by NC 4.0 Deed Attribution Non-Commercial 4.0 International. So that means that you own your copyright, right? It's totally yours, but the readers may copy without permission of the copyright owners as long as they provide that attribute and acknowledgement in the copy. So used for educational, not for profit, right? And there's no open access fee. You know, a lot of journals charge that open access fee. There's no charge to publish in Hypothesis. So one of the neat things about Hypothesis is how it came to be. So we've got a little background here. So it started all the way back in 1987 as the MLA Research Section newsletter. Okay. By 2000, the news began to kind of shift toward the back of the newsletter, and articles became more prominently displayed. By 2005, the word journal was added to Hypothesis for the first time, and the title changed to Hypothesis Journal of the MLA Research Section. In 2012, editor Diane Cooper and the research section began transitioning Hypothesis into a proper journal. They added peer review articles that were clearly defined, identified, and distinguished these as submissions from articles reviewed by one of the editors. And despite it being, this is crazy right here, despite it being indexed and doing all the things that you have to do to have a journal, they were still accepting submissions via email until 2018. Which is, can you imagine? Now we've got a submission process though, which is hosted on the MLA website. Okay. I wanted to show y'all just kind of a visual evolution of it. It started off, and you can just imagine somebody actually sitting and printing this off on a dot matrix printer, right? But it started off just as Library Research Section update, and then it moves to Library Research Section newsletter, and then we get this Hypothesis over the standard deviation there. And the green, the 2005 green Journal of the Research Section of MLA is the one that I remember. So that's when I first came to UAB, and that's what I saw. And then of course I have the Hypothesis up there on the upper right, where we changed it to red, and I have to point out that I was a co-editor back in 2008, and I'm the one that made it red. Now the red did not stick, but it was fun for a while, and I think that part of the reason we made it red was because everything at UAB is green and we get confused. So we tried to make hypothesis red, but you can see the next editors moved it back to green. And then we have hypothesis here for new editors starting in 2006. And then we start to get a name change here, MLA hypothesis for the research caucus when MLA moved from sections to caucuses. And then the last one here is the most current logo for hypothesis. And they changed it to health information professionals. And so I think this is one of the things that hypothesis is struggling with is that it seems that folks think it's only geared toward medical, right? But there are actually a lot of things in here starting to pop up about public health, which is of interest to me, since I am now at a regular university, University of South Carolina in Aiken, and got my doctorate in public health. So I like to see the public health stuff in there. So if you know of somebody that's new to the field and they need a publication, and there's like nursing, public health, exercise science, any health science topic can go in hypothesis. And I did want to show y'all, this is the very first inaugural issue. This is what it looked like. I mean, that's a blast from the past, right? But you can see even in the very first issue, they have a call for papers for the meeting in New Orleans, 1988. I won't tell you how old I was in 1988, but they have already starting to put in research articles. So they're already giving you a bibliography on how to do research. So hypothesis started off trying to help librarians get a grasp on how to do research. So why would you want to submit to hypothesis? So it's got to focus on practical applications of research. So you can write about the process of research, right? So if you have a research project and you're aiming for, you're at a school where you have to have a peer-reviewed journal in with a big impact factor and all of that, but you also, you want to get more than one publication out of your project, right? You can write about doing the project for hypothesis where, and then send the larger one off and see what happens with it in a journal that, maybe has a larger impact factor. But it's not all about research either. The folks at Hypothesis, which includes me, we want you to be successful. We like to work with emerging researchers, and we like to highlight what you are doing. And so I've got this example here. This is a brief report. A brief report is something easy to do, and it's about a project where they're trying to get specific information literacy instruction to students in a college-wide health professions advising program. And so for a brief report, as we'll see, it's like 500 words. It's not very much. You don't have to do a whole lot to get it situated for hypothesis and start to build that record of scholarship. Okay, so we have submission categories. It's, as we said, it's an open access peer-reviewed journal. We've got volunteers. Everybody that works for Hypothesis is totally a nonprofit. So we don't charge for anything or anything like that, all from Medical Library Association and other professional associations. And like we said, we like to work with new folks, but we also like to work with established health science researchers too. So we have 5 peer-reviewed categories and 2 editorial reviewed submission categories. And then here are the dates. We usually have a March issue and then a September issue. So let's look at this brief report. All right, so brief report, you don't even have to have an abstract for this one. You can. I have the example over here of graphic medicine reading experience for undergraduate nursing students. And they included an abstract, but you do not have to. So you have 500 words or less to write up a project, paper, or previously presented poster or lightning talk. So you've already done the work for a poster. You've already done the work for a lightning talk. Why not write it up and have it included in Hypothesis to get even a larger audience? It can resemble a shortened voices or failure, a methods moment or research. So it can look like those, but it's much shorter. It can discuss a program or a project. Include sections. It has an introduction, a description, and outcome, and that's it. So, but if you have a topic that it doesn't quite fit, we'll work with you to adjust it so it fits your topic. And so this one, the graphic medicine one, was started off as a poster. And so then the person went to this little brief report and then on to larger and larger publications. So again, it's just, you have 500 words, and that does not include the heading, title, captions, or anything like that. You don't have to have citations. You can just tell about your project, and you can turn that conference submission into a little peer-reviewed publication. Now, the point person for that is Margaret Hugelin, and she is the current editor of Hypothesis. Okay, and here's what some folks have said about writing a brief report. Somebody said it seemed like a perfect fit to do a quick report out of some important efforts that I led at my institution. I liked that it had a shorter word count, but was still peer reviewed. It forced me to pare down what I was saying and focus on what was most important and of interest to other librarians. And somebody said to think of it like a trailer for a movie, right? So this is kind of getting people interested in what you're doing, kind of getting a teaser out there so that when when they see your name at a conference or in a conference proceedings or in a conference presentation, they'll say, oh, I remember that person, right? Now, this is my favorite submission category. So this is a failure because we've all had things that did not go as planned, right? And that's normal in research. Things oftentimes don't go the way you plan them to do. But one way we learn about failure is the greatest teacher, right? So share your failure, share what did not work. You've got 1,500 words to do it. You can have casual language, right? And it's a hypothesis failure submission. And generally the larger big journals, you want to publish something positive that happened. Well, that's great. And those journals look for those kinds of things. But if you did a project and you learned something important because it didn't work out as planned, there's just as much value in that as a project that worked exactly the way you thought it would, right? Because then lessons learned. And so I've got an example of a book club, and they came to a conclusion that they had a deeper understanding of rural public librarian circumstances and needs. And the investigators gained new insight on how health sciences librarians could help reach public libraries more effectively in rural areas. So they tried a book club kit. It didn't work out as well because they didn't understand the needs of those rural librarians as well. So that's you got to understand your users. You got to know your audience, right? So a failure, but out of failure comes success, right? All right. Now we have this one. This is a good one too. I like this one too. It's a methods moment. So you can have done a study and used a certain method, and you can get a second publication out of writing about how you did your study, right? It should be written in a casual, practical style. It will undergo double-blind peer review, right? It's not supposed to be comprehensive. It's just supposed to give the person reading it a familiarity with your topic and help them imagine the topic's practical application in health librarian research, right? So this one is methods for evaluating database coverage. So if you look at that, and I've got the link here, if you want to go and read any of these articles, if you zap that number right here, you can go straight to that number. But it's pretty easy to navigate the Hypothesis website too, right? So you got 1,000 words to tell people about your study technique or how, or the method or how you analyzed it. So if you're somebody that did a survey or some sort of research project where you use this statistical, have problems with S's, a stats test, then you can explain that stats test and how you used it in your study, and that's a second publication based on your same work, right? All right, then we have the full-on research submissions. You have 5,000 words if you want to write up your whole research project, like with all the structured pieces of the article, methods, introduction, methods, discussion, analysis, all those things. You have to have a structured abstract for this one, and I've got an example here. So you've got your objectives, methods, results, and conclusions. But the research type can be whatever you want, right? It can be a systematic review, it can be a survey, focus groups, case reports, so qualitative, quantitative, doesn't matter. Mixed methods, I'm a big fan of mixed methods, I love that. And you can write up your whole article, open access for free for hypothesis. And the bonus is that, especially for newer people or people, you know, trying out a new sort of kind of method of study or trying to dip their toe into a new analysis method, we will work with you to make sure that we get everything fine-tuned and help you with your research project. And this is a good one, voices of experience. So like research advice for those just starting out. And that was one of the things in hypothesis when I got to UAB that helped me were the articles telling you how to do research and telling you how things kind of worked. So do you have something to share? I know all of you have something to share, right? Share your expertise. You've got around 3,000 words to talk about what you've learned in the field, what you learned about this research method, what you learned about whatever, is a great way to add to your CV and get a publication that actually helps people. Now we have two editorial reviewed categories. We have an invited commentary. This section right here published position statements, MLA annual research awards, other kind of related content. We also have letters to the editor. They can be general commentary of topics of interest. There's certainly a lot to write about these days. Or you can comment on a recent research publication that appeared in Hypothesis. So if you write a research commentary, then it will also be sent to the lead author of the paper you're commenting on so that they can reply. And they'll be published together in that issue. And the editor for these, the editor does reserve the right to kind of edit these submissions, but you will be informed of the suggested changes. And there's no word restrictions, word limit restrictions on these at all. So if you just want to write a commentary on AI, write a commentary on things that are going on in your library, challenges. We have a challenge right now. Professors are using AI to check for AI, but AI is not there yet. You can't just use any AI tool to check for plagiarism, right? So that would be something that might be a cool commentary. Now, currently, we have this right here. We have a call for proposals for a feature issue on emerging LIS research. So we're seeking submissions from novice researchers. If you know students, you got students in the library that need a publication and newer authors. You don't have to have it finished to submit your proposal. That's why it's a proposal. And they'll be accepted in the following categories. So we got a brief report, right, which is great for describing a work in progress. We've got conference abstracts. So if you're, submit your conference abstract for publication and editorial peer review. So if you don't have time to write a full report, you can submit your abstract. Methods moment, right? So like I was saying, this is great for describing the method you used in your research project. We have the failure. As Margaret says, we learn most from our toughest moments. So this is a great option if things aren't kind of going right. You kind of want to write it up Sometimes writing it up kind of shakes some things loose and you can figure out what's going on. Research, you can do a research one or a voice of experience. Just because you're new to the field doesn't mean you don't have experience in other things or any experience at all. You can write about your experience, whether or not, you're new to the field or not. And we've got the key dates up here. We have call for paper closes in September. So we've got plenty of time. So this is something to think about. Now this is pretty cool. Just recently, we had inaugural March Madness Journal speed dating. Did any of you all go to that? It was attended by 57 people, and apparently it went really, really well. So they are going to make this an annual thing, right? But look who was there. Library Trends was there, Medical Reference Services, Quarterly, Hypothesis was there, Evidence-Based Library Information Practice, Journal, JMLA was there, Portal was there, and Hospital Librarianship was there. So a number of journals, and they had the agenda. They had 5 minutes to share something and breakout rooms. And then you could get an appointment to talk to a journal editor, right? How cool is that? So they're going to do this annually now, once a year, speed dating with journal editors. How cool is that, right? So hopefully what's happened is piqued your interest about Hypothesis as a place to publish your work. Like I said, we are there to help you. If you know of anybody, I'm going to leave this right here. If you know of anybody that would be interested or maybe need some additional help, we are happy to help get your work published. And like I said, it's a great place for new folks, but it's a grassroots thing, right? It's not for profit. It's free online to anybody. So there are no barriers for people to get to your research when you publish an hypothesis. It's just there. And you can copy and paste your URL and put it into your CV, your annual evaluation, anything like that. And the person can just click on it and not have to log in or anything. It's just there. So if you don't have hypothesis in your article linker, you might add it to that. But if I think we're get close to 125. So if we've got any questions, feel free.